Mysophobia, also known as germophobia or the fear of contamination, is a type of anxiety disorder that involves an intense fear of germs and a compulsive need to avoid them. This fear can be so severe that it can interfere with a person's daily life, causing them to avoid certain situations or places that they perceive as being contaminated. In this article, we will explore the causes, symptoms, and treatment options for mysophobia. Causes of mysophobia. The causes of mysophobia can be different for each person, but there are some common factors that may contribute to this fear. One of the most common causes is a traumatic experience involving contamination or illness. This could be a personal experience, such as getting sick after being exposed to germs, or witnessing someone else become sick or die from an infectious disease. Another factor that may contribute to mysophobia is a pre-existing anxiety disorder, such as obsessive-compulsive disorder (OCD) or generalized anxiety disorder. People who suffer from these disorders may be more prone to mysophobia, as they may be more sensitive to stimuli that trigger anxiety or obsessive thoughts. Symptoms of mysophobia. The symptoms of mysophobia can vary depending on the severity of the disorder. Some people may experience mild anxiety or discomfort when they encounter germs, while others may experience severe panic attacks or physical symptoms such as sweating, rapid heartbeat, or nausea. The most common symptoms of mysophobia include avoidance of situations or places perceived as being contaminated, fear or anxiety related to touching or being near objects that may be contaminated, compulsive washing or cleaning behaviors, excessive use of disinfectants or hand sanitizers, difficulty functioning in everyday life due to fear or anxiety related to contamination. These symptoms can be very distressing for people who suffer from mysophobia, and they can interfere with their ability to function in everyday life. Treatment options for mysophobia. There are several treatment options available for mysophobia, depending on the severity of the disorder. One of the most common treatments is cognitive behavioral therapy (CBT). This type of therapy helps people to identify and change negative thought patterns and behaviors that contribute to their fear of contamination. CBT can be very effective in helping people to overcome their fear and develop healthy coping mechanisms. Another treatment option for mysophobia is exposure therapy. This involves gradually exposing the person to germ-related stimuli, starting with less anxiety-provoking situations and working up to more challenging ones. This can help to desensitize the person to their fear and build confidence in their ability to cope with contamination-related stimuli. Other treatment options for mysophobia include medication, such as any anxiety medication or antidepressants, which can help to reduce physical symptoms of anxiety, and relaxation techniques, such as deep breathing or meditation, which can help to calm the mind and body. Conclusion: mysophobia is a type of anxiety disorder that can be very distressing and can interfere with a person's daily life. Fortunately, there are several treatment options available for mysophobia, including cognitive behavioral therapy, exposure therapy, medication, and relaxation techniques. You suffer from mysophobia. It is important to seek help from a qualified mental health professional who can help you to overcome your fear and develop healthy coping mechanisms.